So welcome everyone to our next session on exploring the elements and interconnectedness of our local food system. I'm Maria Pepitas from the University of Delaware Cooperative Extension, and Jerry Hush is also here from the University of Delaware Cooperative Extension, and we're really pleased to have you with us as we look at a different segment of our food system. We are hoping that through this series and as of, during today's session, you're going to learn some things. And here's the list, right? To better understand some of the characteristics of our local food system, to be able to identify some of those opportunities that we need to address to strengthen our local food system, and to better understand how you can become more informed and involved. This is a map that we've been sharing throughout the series that kind of shows the complexity of our local food system. And today we'll be talking about a lot of things sort of on the right-hand side of this model that kind of speaks to consumers and their access to food and their food security. And so I would be remiss without thanking our partners from the Department of Agriculture, both here in Delaware and in Maryland, as well as other organizations that have really worked hard to kind of pull all the right people together to be with you and provide some insights into our local food system. So today, without any further ado, we are going to be talking about knowing the consumer in our region and increasing their food access. And with us today, we have Gina Christ and Aaron Norris and Karen Shore and Chad Robinson. And you can see they are from kind of different places, but they all help support food. Well, they help to improve food insecurity. And with that, I am going to stop sharing and turn it right over to our panel.
Thanks, Maria. And thank you, as Maria mentioned, everyone for being here. We're really excited to have the opportunity to really focus on that other side of the model. So my name is Gina Christ. I work for the University of Delaware Cooperative Extension. I'm the community health specialist there, and I oversee a lot of our work that relates to community health and specifically access to food, as I oversee the SNAP education program for the state of Delaware and for the University of Delaware specifically. And I'm really pleased and excited to be joined by a lot of the colleagues that I work with in that space, both from the SNAP perspective, but also just really looking at consumerism as it relates to food in our state, specifically in Delaware and in the region, connecting, with our local states, Maryland and others. And so I'm going to give my panel an opportunity to introduce themselves, and then we'll kind of loop back around and get into our presentation. So right after I give my little spiel, Aaron Norris is going to have the opportunity to share. And so Aaron, I want to have you introduce yourself.
Sure. Thank you so much. And good afternoon, everyone. My name is Aaron Norris. I'm at Delaware Emergency Management Agency, otherwise known as DEMA. And I am a now recovery planner. I know it said natural hazards. We recently changed our planning section here at DEMA to the recovery section. So we focus on recovery and mitigation programs, and very happy to be here. Thank you so much.
Thanks, Aaron. And so as you'll kind of hear as everyone introduces themselves, we represent interactions with the consumer in various ways. So our next presenter is Chad Robinson, who works for the food bank and interacts with consumers who use the food bank as a point of access. So Chad, I know you just dropped your information in the chat, but go ahead and introduce yourself.
Good afternoon, I guess, everybody. My name is Chad Robinson. I'm the Director of External Affairs at the Food Bank of Delaware. In my role, I'm responsible for the advocacy, public policy, and government affairs of our organization, as well as our community and partner relations. We are the state of Delaware's single biggest hunger relief entity serving the entire state.
Thanks, Chad. And then our other, I'm not going to say our last, our other presenter is Karen Shore, who is working with us specifically in Delaware, but has a vast background in working nationally on this issue. So really kind of rounding out our panel. So Karen, go ahead and introduce yourself.
Hi, everyone. Thanks, Gina, and thanks, Maria and the other partners for welcoming us today. As Gina said, I am a food systems expert and work really at the intersection of food systems and health equity and other social determinants of health. So I'll be talking today about our nutrition and security work with retail, but also that has a very specific equity lens that I'll be sharing as well.
Thanks, Karen. So we're kind of going to do this in a little bit of a panel style, but everyone's kind of been prepped. So because we're not like on a stage, we figured it was easier to just kind of do a presentation. So I'm going to kick us off with a little bit of information, just kind of setting the stage for what kind of food security looks like, specifically in Delaware, and kind of start to try to shift some of our terminology. When we think about the consumer side of things, which, as I mentioned, is kind of the focus of today and the interaction that most of us have, we really want to think about nutrition, right? And so we're going to kind of, I'm going to share some information related to kind of shifting terminology that we're hearing in the landscape of this work as it relates to consumers or as it relates to nutrition education, and really thinking about how we make sure that we're not only providing access, but we're providing that nutritious access. So Maria showed you this already. So I had this here as kind of a placeholder to say that we were, our panel is going to focus really on the right-hand side in terms of that consumer, what we know about consumer values, their knowledge, their preferences as it relates to accessing food, and how that really plays into where they want to get their food, how they want to get food, and really what food means to them, and kind of, really recognizing that as we put into place these opportunities for increasing access to food, we really need to think about that kind of cultural context. Karen mentioned health equity, and that's really important for all of us that kind of interact on the consumer side, really just making sure that we kind of really keep that as at the forefront, and we really think about kind of how people utilize food as a cultural experience, and we don't ever want to diminish that. So always kind of thinking about that as we put into place these ways in which people can access food. So I mentioned kind of looking at terminology, and so I just want to kind of again think about kind of as we're talking today, kind of thinking about shifting that language from food security, which is the availability and the access of food to all people, to nutrition security. So nutrition security means that all Americans have consistent access to the safe, healthy, affordable foods essential to optimal health and well-being. Nutrition security builds on food security by focusing on how the quality of our diets can help reduce diet-related diseases. So if you are not familiar, Secretary of Vilsack actually released a nutrition security plan at the national level. Gosh, I guess it's been about a month now. I was going to be like last week, but I think it's been about a month. And it's focused on 4 pillars. So I strongly encourage everyone to take a look at that. It's really showcasing that there is this national focus on making sure that not only are we providing food to Americans, but that we're making sure that it's nutritious food, and that everyone, again, kind of from that equity lens, should have access to safe and affordable food. And whenever I kind of talk about this, I always highlight the safe piece too, because as you'll hear kind of from Aaron and Chad, who work really in that kind of exchange of food with consumers, food safety is a huge issue. As we think about kind of getting healthy food on the table, we really need to think about kind of how we do so in a safe way. So again, just kind of change, we're really seeing this from the consumer standpoint, we're really seeing this focus on nutrition, which is really exciting, but is definitely a different way of thinking about that kind of movement of food and where and how we can get it to people, both in a safe and affordable way. So food security is having enough calories. Nutrition security is having the right calories. So for those of us that work in health, we really, again, kind of want to think about how we make sure that not only when we feed people, we're feeding them for calories, we're feeding them in a way that provides them the nutrition that they need to grow, develop, and function kind of in a way that allows them to be successful. So really thinking about nutrition as an equity issue, and making sure that we, from birth through death, everyone has the opportunity to have the right calories that they need as an individual in order to thrive. So again, just as we kind of talk about this issue and we talk about kind of consumers, what does the consumer landscape look like right now? So in 2021, we saw that there were 17,304 participants of WIC, which is our Women, Infant, and Children program that it's a government funded program that provides funding to families who qualify with children birth through age 5 to access food. And then once people age out of the WIC program, the next kind of government funded program is SNAP. So you'll see that here too. SNAP participation as of January 2022 was 120,155 individuals. And you can see there a little over 59,000. So 59,259 households. And so again, this is kind of just this is a quick snapshot of what we're talking about when we talk about nutrition security. Who are those individuals that are seeking healthy foods through government funded programs, through potentially access at different types of venues, such as corner stores, convenience stores, dollar stores, because we know that individuals who participate in these programs generally are living in low income communities. And the data shows us that the access points are generally not as vast in terms of that nutritional food access. So why is this important for all of us to think about as we think about the consumer? Because it drives really how people can access food. So, thinking about those numbers as it relates to funds. So this is, again, kind of SNAP, the amount of money that a participating family on SNAP would receive per month. So it's really about recognizing that a lot of individuals in our state, 120,000 plus, that's been ebbing and flowing a lot in the past couple of years. But at any given time, this is the amount of money that they might have to purchase food for the month. So you can see one person is $250, 4 people, $835 for the month. I don't know if you've been to the grocery store lately, but I can tell you, as we kind of think about the way in which the market changes, it impacts some of the families who receive government benefits the most. That's when they're really forced to make choices around where they can spend dollars around food. And so we really, again, kind of want to lean back into that safe and affordable notion. And so recognizing that we can't go through thinking about the consumer without thinking about the pandemic that we just went through and how that pandemic has influenced a lot of programs at the national level that are trying to assist our families who may have needed additional benefits throughout the pandemic. So SNAP online purchasing, we're going to talk a little bit more about that a little bit later, but this means that individuals who utilize SNAP are able to use those benefits online. However, they can't use it to cover the cost of delivery or that cost that like the service fee. So again, kind of something that's put into place that could be really helpful, comes with a little bit of challenges. So just kind of recognizing, again, from that consumer perspective, this is where things get sticky. There's a lot of things that are, really, really good. And we're on our way to having some really innovative programs happening, but we just also need to think about kind of where are there some sticking points, and that's one there. Pandemic EBT, that increased the amount of benefits for families who had school-age children who were not receiving school meals during the pandemic, because a lot of times school meals are that safety net for a lot of our children. So it maximized the amount of benefits that families could receive. There were emergency food benefits put into place, emergency cash benefits, and decreases in paperwork and work requirements. I'm not going to go into great detail on all of those, because one of the things that, one of the most important things here is that most of these will go away. And so important to just know that we're going to have a lot of consumers that had some increase in their safety net, if you will, as it relates to government benefits. And that once these kind of start to decrease, we will have individuals who are still unemployed perhaps, and who we're going to have this period of time where they're going to be potentially interacting with the food system differently. So it's kind of another change in how they're receiving benefits and how they might be able to interact with the retail side of things. So this is kind of from a consumer perspective, again, just recognizing that things can get confusing. As you can imagine, I just went over one slide, and there's, I could probably talk for a whole hour on how just even these government funded programs can sometimes provide really good opportunity, but can also be really confusing for the consumer. And so recognizing that as we work to increase access, we also need to make sure that we streamline and we make it very easy for individuals to access food as well as utilize benefits. So you'll hear kind of from some of my colleagues and how we might, how we're looking at doing that. So this kind of shifts us into what some of my colleagues will share. So really thinking about kind of how we address some of these issues, thinking about online purchasing, that's going to stick around. So how do we increase the likelihood that SNAP beneficiaries are using online purchasing, but not just SNAP participants, really thinking about consumers as a whole. I know that a lot of people, we're seeing the data that a lot of people are not going back to the grocery store to shop. So again, not just our beneficiaries, but also those individuals who are busy and looking for convenience. So really thinking about kind of online purchasing as a way to encourage nutritional food access. Looking at farmers markets and the expansion of those in terms of accessing healthy foods. Again, we're going to kind of see that decrease in pre-pandemic benefits. So we want to make sure that we are meeting the needs of our individuals as we kind of see this kind of drop off. So that cliff's going to come. And then again, that national focus on nutrition security. So I do, again, kind of encourage everyone to start to think about kind of utilizing that terminology because we're going to see that more and more. And so at that point, I'm going to stop talking about kind of the snapshot, and we're going to kind of move into some action-oriented things that we're seeing across our state and others as it relates to making sure that consumers have access to nutritious foods. So I'm going to turn it over to Erin, and I will drive your slides for you.
Thank you. So I think I'll first want to start with just kind of going over what is sort of the role with DEMA in the food realm. DEMA is, and most, well, really all state emergency management agencies, they act as the lead coordinating agency when there are disasters. So if there is a hurricane, flood, what have you, we will act as the lead coordinating agency. And there's a lot of functions that fall within that. But typically anything that falls into the feeding realm, as we call it, feeding operations, that's under the mass care programs. And we coordinate with FEMA, we coordinate with USDA and other agencies. But I kind of wanted to highlight how the pandemic has really shifted things, and things were shifting. I put a picture here of Sandy, which, crazy enough, we're coming up upon the decade anniversary of that this year. But with Sandy, there was a lot of distribution and focus on MREs, which are meals ready to eat. So those might be those like Snap Pack, they quickly heat up, packaged meals that are very easy to distribute mobily and quickly. And they're also very easy to make. What we saw in the pandemic was a kind of like a shift to, I guess it was more a knee-jerk reaction to start pushing MREs. And I remember I started having conversations with the mass feeding operations group. In Delaware, we operate under our Delaware Emergency Operations Plan. And then we have specific groups that focus on certain areas like feeding. So we had a lot of information coming from FEMA and other agencies when they passed basically with the Defense Logistics Agency, they were able to mass produce things like MREs. But there was really no interest in that. And I think that definitely threw a little bit of a wrench in the plans, as you say, for a lot of emergency managers, because that's kind of a quick go-to. It's also kind of thinking the method is with a response is that, you are immediately working your way out of the disaster. But when we have a pandemic, there are so many unknowns, you're not necessarily working your way out of it. In a sense, you're just continuously trying to mitigate. So when you're working on trying to push out MREs, individuals are in the homes, you really have to shift to programs that is really meeting people where they are. So I put an example of the food bank, which I'm going to leave to Chad to really shine on, but that one of the mobile distributions is a really great example of providing nutritional food and meeting people where they are with the needs that they have. So, and increasing access. getting back to kind of how that works, there's a lot of different frameworks with emergency management. And the common way that you see things, you have an emergency support function, ESFs, as we refer to them. And that oversees a lot of the items that fall within mass care, which is commonly your feeding, your sheltering, housing, and other human service needs. And I put a little picture here. This is kind of just how things tend to operate. A lot of the agencies that are the primary, again, you'll see that terminology of coordinator, and then also lead agencies and support agencies. And that kind of, again, with the pandemic was very unique because, typically you have a certain incident period of that emergency response, but this was a very elongated period. And so it allowed for a lot of unique programs to come into play, and kind of taking some of those best practices that came from the Sandys and the Marias and Irmas and implementing those, which I'll get to in the next slide. But I also want to kind of talk about how we look at when we transition from emergency to recovery. With the pandemic, there never really is, I will also say, in any disaster, a very easy way to transition from your emergency phase to your recovery phase, because no one is going through recovery at the same pace. Emergency phase may be a short amount of time for one person, and it may be months to years for another person. So the recovery phase is very unique in how it could be defined. And again, with the pandemic, I think it really kind of flipped and tweaked a lot of our plans, which was great because we're able to look at past disasters and try and put into some best practices, and then also had the room to do things that were more unique to really meet the needs, and again, meet people and individuals and families where they are to get these feeding services out the door. So, if anyone's interested, you can look into the emergency support feeding functions as well as the recovery support. Recovery, when it comes to feeding, is definitely unique because people are in very different places. I think right now with Ida, we are learning a lot from the flooding in Wilmington, where we had lack of electricity. Utilities were down for quite some time. I think it was actually a little over 2 weeks for many individuals in the community. And so when you're thinking of how to get things back up and going, you want to make sure that you're getting up all the places where people will go, the grocery stores where people will go, other convenience stores where they may get their foods. But if you have a flood that has completely damaged things with 8 feet of water, and those places are going to be taken offline for months, maybe over a year, then you want to make sure that you're thinking of additional inventive ways to make sure that individuals are getting the feeding resources that they need. And they'll also be now housed in different locations. It could be in temporary housing. And so the feeding programs are very unique, and it's always very flexible. And there's so many partners. When you look at that list of the ESF support agencies, Department of Agriculture, all the way down to our national VOAD members, who really are significant when they come to meeting people where they are and providing that nutritional need that is necessary. Some of the best practices that I wanted to highlight that came out of COVID, and they really kind of came out of a lot of other past disasters. And it's crazy to think that Sandy was only 10 years ago, but it really kind of tweaked the way feeding goes on. Because like I mentioned, there was a lot of places that were taken offline for a long time. It wasn't a matter of just getting the utilities back up so that people would be able to, operate their credit cards and make the purchases they need and all things like that. And foods could be refrigerated. It was a matter of you lost those resources holistically, and now they need to be replaced in certain ways, or people are living in temporary ways and they need to receive appropriate nutrition. And some people with dietary restrictions as well. So that's why there's so many partners that come into play. And I think it's just the really important key is just meeting people where they are. And what we saw after the pandemic was we saw a lot of immediate closures of congregate feeding sites, but then we also had to expand the services of non-congregate feeding options. So, and then we also had the limited amount of the volunteers. And so typically with that, we had a lot of assistance from the National Guard in those cases, And then a lot of states were doing all sorts of unique things. There may be people who were, deemed as essential workers who were able to do these certain roles and provide services. Maybe they would expand on programs like what Meals on Wheels does. And then I wanted to highlight also kind of that congregate feeding site moving to non-congregate. So what World Central Kitchen does, if anyone is familiar with Chef Jose Andres, they basically created a program after the pandemic that would allow restaurants to kind of assist some of these congregate feeding sites that weren't feeding in a necessarily congregate way, but we're seeing such an increase in demand with the population that they serve. So restaurants were basically just adding to rolling into the fold and expanding services. So this was an example of World Central Kitchen operating in Delaware with Cosmos Restaurant in Wilmington. And there was another restaurant as well. I forget the name, but it's in Hockessin. And they were assisting Ministry of Caring, which was providing services to an expanded population during the pandemic. And this was all throughout the summer and into the early fall of 2020. FEMA did publish community food distribution, community innovations. So commonly, the only role that you would see with direct relation of FEMA or emergency management agencies directly in feeding assistance is going to be with those MREs. And also commonly, it's not something that FEMA would directly reimburse, because the way FEMA operates and emergency management programs operate is it looks to see who is legally responsible for carrying out those services. And oftentimes it's not that emergency management agency that is legally responsible for that. Oftentimes you'll see nonprofits who are legally responsible, or it may be another state agency who passes on that legal responsibility. So FEMA actually changed that when it came to the pandemic. They created a program which is called the Purchase and Distribution of Goods, of Food, for the pandemic specifically. That program is still ongoing. I'll put an asterisk there because there's a lot of changes now that we are going. I would say it's kind of looking like now for the pandemic, we are looking into that recovery phase transition in a sense, especially to long-term recovery out of the pandemic. So some of the programs are changing. We had the USDA Farmers to Families Food Box program, which is the picture on the right. That program was really wonderful, very well received. Provided a lot of fresh foods. And I think that that is definitely something, as Gina mentioned, that we're going to be seeing in the future. I remember back when I started, I worked for the American Red Cross for years. And one of the things that you first learn is there are certain foods that you're going to be providing after a disaster. You look for things that are sweet and salty, high in calories, and also comfort foods. And that's why there's a lot of great relief organizations that can provide things like that. Your Operation Barbecues Relief, Salvation Army, and Salvation Armies and American Red Crosses are able to provide a lot of mobile services. But when you get further out from the event date, the incident period, as we like to refer to it, you see those needs for feeding change. You can't just continuously give a peanut butter sandwich. You're going to get so many complaints. Even after the third day, you're going to get complaints about a peanut butter and jelly sandwich. People have allergies. That needs to be accounted for. And also, it also provides a time. I think that was the biggest challenge in the pandemic, was that a lot of times when you have a shelter, no, shelters are not the best places to be. However, it's a great place to have a lot of resources shared in one common space. So a lot of times, if you're sitting down with your family at a meal, you're talking about your day. It's kind of an ability to kind of be a stress reliever. So when we can have congregate feeding and have a meal site where people can come who've experienced disaster, are experiencing continued challenges, you can have people that are there to provide that mental health services, also provide access to different resources. Perhaps people need help filling out applications for different programs. You can have that all in one location. One of the best practices for that in mass care services is a MARC. It's a multi-agency resource center. But with the pandemic, we couldn't do that because we couldn't congregate. So it was a matter of really trying to tweak and continue to get services in different places in different ways. And then when you're further removed from the incident period, you want to healthy, nutritional, fresh foods as best as you can. And I think with this program that the USDA had carried out, it was a really great way to do that and to meet those needs. And there's a lot of great ways that organizations had done in the past. And after Irene in 2011, downstate New York, which is just north of New York City, that there are many counties there that were providing a really great access to fresh foods. They had a large gleaning program. They had a lot of CSAs, and there was, they're basically called Ulster Corps. It was a program in partnership with New Paltz University and AmeriCorps members. I saw there's an AmeriCorps member on here. Shout out, I'm an AmeriCorps alumni. Wonderful to have you. Excellent program. And they basically provided that nutritional need for fresh foods in the long term. So rather than doing like mobile feeding of scooping out, of providing, meals in clamshells, as we would always say, there were services that were provided by a lot of those VOAD members, which are volunteer organizations active in disaster, that were providing mobile access to fresh foods. So CSAs and other local farms were providing fresh foods. They would go on a bus and provide those resources. So there's a lot of great, unique ways. And I think that the pandemic has really set forth the path to make sure that we're incorporating all these things in our plans, and there's going to be better access to better nutritional foods in that recovery period. So there's a lot of great things and great things happening in Delaware as well throughout all of our partnerships. And that's really all that I have. I think that's my last slide. So thank you so much.
Thanks, Erin. And then next, kind of segueing from that into, I'm going to go back a couple slides, but Erin touched a little bit on the work that they do, but I'm going to have Chad kind of cover the work of the food bank.
Well, it's good to be with everybody today. So again, my name is Chad Robinson. I'm the Director of External Affairs at the Food Bank. I want to thank everybody that's on the call today. Certainly great for us to be with you. And we could just put Gina on the payroll. She did a great job at the beginning of highlighting some of those issues that are vitally important, and kind of really setting the stage for what food insecurity looks like in the state of Delaware. And I think that Gina raises an interesting point, and there are two very unique but very interconnected conversations that are going on right now as it relates to food insecurity and nutrition security. I was touched or hit, if you will, by her comments earlier, because I legitimately was on a call the other day where we shared a conversation about the word, and I don't like this word, but I'm going to use it because that's what was used in the call I was on, about not letting food security get hijacked by nutrition security. That we have to make sure that folks have access to food before we can talk about access to nutrition, and that access to food at a core is something that's vital. But I see them as not separate conversations. I see them as intertwined conversations, because while we're providing folks access to food, it needs to be the best food that we can provide for them, the most nutritious, the most sustaining. And I think that is where the interconnectedness of that conversation lies. And so for me, I don't see it as separate conversations. I see it as a together conversation, and I know my colleagues on this call do as well. I want to shout out Erin Norris. Erin has been our partner at the food bank since the very early days of the pandemic. You might have seen me smiling a couple of times during her presentation, because we did have conversations about MRAs. We did have conversations about food security. We did have conversations about congregate feeding and non-congregate feeding, and World Central Kitchen, and FEMA programs for production and distribution of food. So it is amazing that we stand here now, a little over 2 years after those early days, and we're having these conversations, and these conversations continue about access for food, and how we can best serve people. But I do believe there's silver linings. We're in a better place, I think, than we were 2 years ago as far as some of those learnings that Gina highlighted at the beginning. Some of the programs and things that have been created over the course of the pandemic are things that definitely provide a framework for moving forward. I would say, are more than best practices, are the right thing to do. And hopefully we learn from that in such a way that our elected leaders and others can find it within themselves to make changes that I think are necessary to provide long-term food and nutrition security by utilizing some of the best practices we learned in the pandemic. So with that, I'll share with you a little bit about what we do here at the food bank. The long story short, our vision is a community free of hunger. That's our goal. We live in the greatest nation on the face of the planet, and no person should in this country should not have access to food. If you remember Maslow's hierarchy of needs, food is a basic is a person's basic need, and so no person in this country should not have access to food. We achieve our vision through our mission of providing nutritious foods to Delawareans in need and facilitating long-term solutions to the problems of hunger and poverty through community education and advocacy. Excuse me. We see this as not just food for today, but also food for tomorrow. How can we meet a person's need for today? How can we provide the substance that they need as far as food is concerned for today? And how can we then look forward to tomorrow and allow that person to become more self-sufficient, allow that person to have more stability. And so that is how we consider, food for tomorrow, and addressing that through community education and advocacy, which I'll talk about in just a minute. Why are we needed? According to Feeding America, there are right now somewhere in the neighborhood of 112,000 food insecure Delawareans today. That number is still elevated from where we were before the pandemic. That number was estimated at around 105,000 prior to the pandemic. At the height of the pandemic, it was estimated around 140,000. I say this all the time. It's not that I don't believe these numbers are correct, but do I believe they're not correct? I definitely think there is a lot of folks in our communities who maybe don't know that they're experiencing food insecurity. They don't know it's such a normal part of their lives that they don't maybe constitute it as food insecurity. And it's a part of what they go through. So I definitely think that, from a reporting standpoint, that there are more folks in our community that are probably experiencing food insecurity than we might expect, or than these numbers might always look at. These numbers are, as it says, always estimates. And so either way, even if it is these numbers though, and we're talking about 114,000 food insecure Delawareans, that means in a state of less than 1 million people, this is over 10% of our population that's experiencing food insecurity. These are people that we know. These are people that we go to school with, that we go to church with, that we work with. It's impossible in a state this size to think that we don't know people who are experiencing food insecurity. Just as Gina did, these are some definitions that we use as part of our conversation. Food security: access by all people at all times to enough food for an active and healthy life. Hunger is something that all of us are more familiar with. I tell people, imagine when you are getting ready for lunch, or lunch is an hour or so away, and you get that rumbly in your tumbly, as Winnie the Pooh used to say. That feeling is just exacerbated by folks that are experiencing hunger, that don't have access to food. Where for us, it's just I'm hungry. For a person that's experiencing food insecurity and hunger, it is truly a personal physical sensation of discomfort, and that is something that, again, too many folks in our community are facing. And then food insecurity: the lack of available financial resources for nutritionally adequate food at the household level. And so we tell folks that when thinking about this, it might not always be that there's not food in the home. Maybe there's not enough. Maybe it's a family of 4, and parents, guardians, loved ones are making decisions to eat less for themselves because they're ensuring that their children have access to food. they're providing that food for their kids. And so that's an example of, it might not be that there's nothing there, but is it adequate at that point for that person at that point in their life? Everyone is food insecure. Their food insecurity does not have a face, a color, a gender, a creed. It is seniors, it is children, it is working poor. It is everyone. If we learned anything in the pandemic, we learned how close people are. When March 2020, came along and we began to close businesses down for very obvious reasons. When a person's first check was missed, for many, that was, a game changer. When the second check was missed or severely reduced, that was life altering. And all of the programs that Erin talked about, and her partnership with us and many other groups that we're feeding with DEMA, was something that was vital, because again, it became truly life altering. But it doesn't always take a pandemic. It can be folks who get their hours reduced, or they have a change, and it changes what they're able to do and what their family is able to afford as it relates to food. So as I said, we see this in responding in two very distinct ways: food distribution programs, food for today; workforce and community development programs, food for tomorrow. So just some highlights. This is last fiscal year by the numbers for us. This is the fiscal year that ended obviously June 30th, 2021. So we're coming to the end of our fiscal year now. But last year we distributed over 15.5 million pounds of food throughout the state of Delaware. The last year that we have that doesn't include any of the pandemic period, we distributed 8.6 million pounds of food. So that gives you some idea of what the pandemic, how the pandemic had an impact on and on our communities. Up here, food distribution by county. Too many people in our state think that hunger and food insecurity is a Newcastle County problem. It's certainly not. I'm not a mathematician, but if you add the Kent County numbers and the Sussex County numbers together, they equal the Newcastle County number, roundabout. And so that tells me that hunger and food security is a statewide problem. It is a rural problem. It is a suburban problem. And it's an issue that all of us have to address, because it's all of us that are experiencing hunger and food insecurity throughout the state. How do we work to address food insecurity? So this is through our food distribution programs. We have a network of partner agencies, over 500 throughout the state. These are food pantries, food closets, soup kitchens, child nutrition sites, senior nutrition sites. They're really the boots on the ground, the folks that are there in the community, that are making sure that folks have access to food. But some of the neat things in the pandemic that we see as kind of best practices going forward. We've established healthy pantry centers at our locations now. These were set up as small, like supermarket type settings before the pandemic, where folks could come in and shop and select the items that work best for themselves and their families, giving them the dignity that they deserve. We're looking to bring that back as we, come into the recovery phase, hopefully, to be able to bring back that program. We have been operating it, but it has been a program that has, put all the food together for folks, put it in a cart. It's been taken out to their car. So we look to bring back that program where folks have the ability to come in and shop. This home delivery program down here, this is a partnership that started during the pandemic with Amazon and DoorDash, where we're able to now deliver food to folks' homes. That kind of last mile delivery, for us, that last mile is sometimes the hardest part. And so being able to get food to folks that need it through those programs is something that's particularly important. I don't want to take too long, so I'm going to jump ahead. Workforce and community development. Again, as Gina was mentioning, it's about long-term sustainability. So we see our role as to not only provide that food for today, but also provide nutrition education, helping folks learn how to make wiser food choices, how to buy food on a budget, how to stretch their food dollar further. So all of those things are things that we are working to help our community with. This says SNAP outreach, but now this is now benefits outreach. Our team is helping folks sign up for not only SNAP, but now also WIC and TANF, general assistance, Medicaid, all of those things to, again, help folks with that stability that they need, and making sure that they're accessing all the programs that they can, so that that it's creating the most opportunity in their budget and in their household. And then Stand By Me financial coaching, where we're helping folks with the things that they want to do. So far too many folks in our community are working and they're doing the things that they need to do, but the access to get back and forth to work. So maybe they want to get a car, maybe they want to be able to have their rent covered each month through their resources. So our Stand By Me financial coaches are helping them learn how to do things like that to meet the goals that they want to reach, so as to help create more access for them over the long term. And then job training. We offer workforce development programs in food service, culinary, and warehousing to help folks get a job. So the goal being that they come into the program, they get the skills that they need, and they're able to take those skills and move them into the workforce and get a job and become more self-sufficient.
Chad, this has been wonderful. You really given a great overview of the food bank programming in Delaware. And we're coming up kind of close to the hour here, and I know
fine.
that Karen has a few things to share.
I was done.
Okay, so thank you so much for all of that. It was really a wonderful overview. So with that, I will turn it back over to Gina and Karen.
Well, thank you. I'll just jump in and kind of provide some background about the work that we're doing. In this case, focused on food retail. Lots of different types of food retail, of course, in Delaware, just like any other state. There's supermarkets, farm stands, roadside stands, dollar stores. As I'm sure people have seen, many pharmacies even have several aisles now of fresh, frozen, and grocery food. So there's lots of different kinds of retail options, and the ability, as Gina said, as one of the many ways that Delaware responded to the increase in food insecurity as a result of the pandemic, was to make available even additional ways for participants in SNAP to be able to access foods online. And there's a handful of retailers, supermarkets in the state that are allowing SNAP participants to shop and either pick up or get delivery online. Why are we focused on retail? Well, we're talking about serving and working with the same populations. So the same, individuals and families who are at risk of hunger and nutrition insecurity are certainly participating in food pantries and food distributions, free and reduced lunch, the various strategies that Gina outlined, as well, of course, as SNAP and WIC. And the goal is to have everyone eligible participating in the federal nutrition programs, but the overlap with who a supermarket, for example, is serving, who are participating in SNAP or participating with WIC, and who the food bank is serving is a very narrow Venn diagram. It's an almost total overlap, and so we're looking at people who are really at high risk. But there's other reasons we're interested in retail as well. We're interested in the equity piece, as I mentioned in my introduction, and we know that ownership in businesses, access to markets for Black and brown farmers. We are very focused on the economic mobility aspects that come from retail, and concerned about wanting to make sure that independent grocers, small farmers, new farmers, socially disadvantaged farmers, as well as BIPOC-owned food businesses are part of what is helping to feed people, but also part of where we're really focusing investment and resources. So we have a survey in the field right now, as well as a lot of community outreach to better understand people's specific needs as it relates to food retail today. So that's in the context of the growing familiarity and use of online options. And our survey covers a lot of different areas, but just to call attention to a few of them, we're specifically asking for people's experiences in a variety of very specific different retail settings and exactly what they want from each one. So one of the things we know is that people want different things from different types of stores, right? And there may be groups that want specific types of food. There's no doubt groups that want specific types of food, right? And so we're trying to understand what exactly do different groups need and want in terms of types of food, culturally preferred foods, the way the food is prepared. Do you want whole, fresh fruits and vegetables, or frozen, diced, cut fruit salads? Those are wildly different types of foods to source and to provide for people. And we know that at the same time that people really clamor and want those farm fresh products, not everyone has the capacity to cut and chop and cook from scratch. And so we're trying to really cast a wide net in understanding what the very nuanced, unique food needs are of different households and communities throughout Delaware. And we're spending a lot of time focusing on the online shopping experiences during COVID and since, to really answer the question of what would people need to do more shopping online? What are the barriers? So there are technology barriers, there are fluency barriers, there's barriers, of course, with the broadband access. But there are other barriers as well in terms of the fees and need for access to a vehicle, for example, if you're doing pickup. So a couple of the things that we've learned so far. So we've gotten about 250 surveys and dozens and dozens and dozens of interviews at this point. And what we're learning is that there's a specific need to look at fresh, top quality foods, and culturally preferred foods are the foods people really feel like they have lack access to the most. So there's a real interest in trying to get the seasonal, delicious produce that often is out of reach for many Delawareans, too many Delawareans. We also know that SNAP and WIC are going to be critical in order to help ensure people have the funds needed to purchase these foods in a retail setting. It also provides a foundation upon which we can really expand and build a statewide incentives network to use fresh fruit and vegetable incentives, for example, to help stretch that food dollar and support additional purchase of fruits and vegetables. Like Chad mentioned, we have exactly the same. It's the same system, right? So the same distribution challenges. So we want to take direct aim at what those upstream barriers are that are creating unhealthy food environments. And one of the biggest barriers is food distribution. And I often try to remind people that it is not only the individuals and households who are experiencing food insecurity and living in a low food access area, but many of the stores also lack access to fresh, healthy, and affordable foods. And so without really solving that challenge, and there's a number of challenges associated with that, we really are going to not enter any kind of ability to have big, bold, much less sustainable changes. So we are doing our pilots right now in Kent County. We're focusing on Dover and Harrington, and those were chosen due to the social vulnerability index, as well as the ability to choose an urban example and a more rural or small town example. And what we're doing is connecting people directly to sources of food, as well as stores directly with sources of food by facilitating the logistics that connect these. So we will have farms that have agreed to serve as wholesalers who will be able to sell their food directly to community sites. That's up above. So say places of worship, fire hall that's doing a community farm stand, for example. People will be able to directly order farm fresh produce, and then grocery stores, especially those smaller grocery stores that often are very common in our rural communities, will be able to order fresh, farm fresh Delaware grown produce and have that delivered by volunteers. So we have a variety of different potential sources of food. Urban farms, certainly farmers who agree to sell wholesale directly into retailer community sites or direct to consumer. We could also source from farmers markets or farm stands, certainly supermarkets, other grocery stores or wholesalers. And finally, the drop-off site can be a variety of different types of sites, both the community sites, the grocers who again lack access to the healthy, affordable foods, and individuals in their homes or where they are staying. So we're trying to leverage technology and the logistics of several different platforms to make these options more available, not just directly to the consumer, but also to the grocers so that they can get smaller batches of produce available for sale at their sites. So I know we've got just a couple of minutes and I covered as much as I could in a very short time, but I know we are eager to answer questions either after or now live. Thank you.
Thanks, Karen. I know we're right at time. I just dropped my email into the chat. So if anybody has questions or wants to reach out to any of the panelists, I'd be happy to field them via email. We really appreciate the time and the opportunity to share a lot of our information today.
This has really been fabulous, and I really appreciate all the work that's being done in Delaware. And I know to kind of coordinate and address the I'll just call it the leaks in the system that certainly got elevated during the pandemic. So thank you for all of that work that you're doing. I would be remiss without saying, hey, next week we're going to learn all about seafood and aquaculture. So please tune in next week as well. And as Gina said, they'd be willing to handle any questions. If you'd like to kind of just stay on and ask questions, that's fine too, for those of you who can. And I put the survey in the chat. If you wouldn't mind just taking a moment and doing the survey, that would be awesome too. Anyone have questions they'd like to pose to the panel? I guess I had one. I know that there's some work that's been done in other states where they're really working cross state lines, cross county lines to coordinate food distribution, as well as kind of do economic development. And this idea of, is there a food hub that could be put somewhere and contracts that are placed with larger employers, for example, or feeding sites where farmers could bring things to a hub and then it gets sort of pushed out. And it sounds like something that Karen was kind of talking about, but we're kind of in this unique peninsula. And so I wondered whether there was any work happening with Maryland in terms of cross-state line work in coordinating some of that food, probably more collection as well as distribution.
So I'll jump in, and then I know everyone's been a part of this conversation for many, many years. So the food hub conversation has been something that's been elevated. They're talking about a food hub up in Wilmington. It has been explored. It has been talked about, not just in Delaware, but yeah, kind of thinking potentially more regionally. And I will say that a lot of where it's kind of getting stuck, or where it does get stuck, is the supply demand issue is still fairly small, just because of the size of the states that we're talking about, or the regional kind of access. We still run into the last mile issue, and then just the logistics of coordination and ownership. Those have been kind of the takeaways I know that I've been a part of, but again, I know some of my colleagues have been more ingrained in that conversation over the years.
Yeah, I was just going to add, there are a number of food aggregators and redistributors in Maryland, and I am not familiar with them, having not worked in that state for a number of years. But I think that in general, I think there's many really good reasons to explore a food hub, but a food hub is not the necessary, infrastructure that needs to be in place to begin, much less successfully address some of these barriers. So it really is one of those things that needs kind of deep study, as I know that you know, Maria. But it's very difficult to answer the question as to whether a food hub would be possible for Maryland.
We also have a question from John. He's raised his hand. John, do you want to raise your question?
Yes, hi. Yeah, I was just going to talk about the last speaker in reference to, well, actually, all the speakers have spoken about how food access is an issue. I work with multicultural communities who are usually not really informed about all these programs. And sometimes I think because of immigration status, with all that has been happening, they are reluctant to engage the food security industry. What have you come across any strategies on how to engage, cultural constituencies that don't really participate as they should? Thank you.
I'll just take that from a food bank perspective. First, one of the things the message that we try to get out, most importantly, is that for us those things don't come into play. We attempt to serve every community as we can. So, John, I'll throw my email in the chat, and would love to connect you with our food distribution folks. To do that. Unfortunately, I think there is a great misconception in the community that some of these things are connected, and as you indicated, there's some reluctance. So we're consistently looking for opportunities to partner with the community, with trusted community leaders in those places, in those communities, to help us reach out. The food for us, I think for us, it's getting access to the place, the community leaders, those folks, so that we can get the food out. But I'll throw my email in the chat and be happy to connect you with our food distribution folks to make that happen.
Thank you.
Well, I would like to thank our panel again today. What great insights that you provided about trends for the future, as well as where we are, what we've learned, and how to really connect back with each of you around whatever issue individuals might have, or interest they may have in kind of being part of the solution. So thank you all very much. Really appreciate your time and energy.